It is a disorder that we perhaps hear often but never quite understand enough. Media often portrayed those who live with autism to be different, awkward, or sometimes even as geniuses, from chess protegés to math wizards. However, autism is a real mental disorder that ordinary people deal with in their day-to-day lives. Today we'll talk about the mental disorder autism. Welcome to Autism Answers. We talk about autism with the goal of sharing knowledge and bringing awareness to light. Our goal is to make videos that are easy to understand, so many will be able to understand and develop a deeper awareness of autism. With that said, we'll get into it. The development of a child's cognitive ability is affected by autism. Typically, the disorder manifests in children within the first 3 years of their lives. Those with it exhibit impaired communication, social interaction, and repetitive or restricted behaviors. Consequently, the problem affects how the brain processes information, resulting in difficulty organizing and connecting events and things. A person with the disorder may experience speech retardation, impaired social interaction, and repetitive behaviors. The disorder can sometimes be difficult to treat on its own. As a result of these complications, treatment programs must be complex. As a result of the disorder, a person may experience sensory problems that can be painful and discomforting at times, resulting in sensory problems. Additionally, these problems may not respond to pain, heat, or cold. Seizures are another common complication that typically develop in young children. In addition, tuberculosis sclerosis causes tumors to develop in the brain and mental retardation, including Fragile X syndrome, a common mental retardation problem in males. Aggression, digestive problems, and poor eating and sleeping habits are among the others. The disorder is part of the autism spectrum, along with Asperger syndrome and pervasive development disorder. Even so, mental disorders like autism spectrum can be treated with various forms of therapy, so they're not as problematic as one may think. The autism spectrum disorder is a neurological disorder that causes people to have difficulty communicating and socializing. While lecturing on child psychology in Germany in 1938, Hans Asperger adopted the terminology blurters of autistic psychopaths to describe autistic children. In his 1943 report on autism in children, Kanner used the term infantile autism to refer to children who exhibited striking behavioral similarities. In 1981, the term was widely used as a separate diagnosis. This disorder includes autistic disorders or classic autism, pervasive developmental disorder, not otherwise specified, or atypical autism, Rett syndrome, childhood disintegrative disorder, and Asperger syndrome. Asperger syndrome differs from autism in a few ways. People living with this disorder have difficulty developing their language. Their language is either lacking, or it is delayed, or it is deviant. Additionally, they do not experience cognitive delays and tend to be obsessed with a particular topic. There are also many other symptoms associated with these disorders, including inappropriate social behavior, uncoordinated, clumsy movements, peculiarities in speech and language, repetitive routines, etc. An Australian psychiatrist and pediatrician named Asperger Hans devised the disorder, which has been recognized in formal manuals of diagnosis since the 1990s. A person with Asperger's has difficulty interacting, associating with others. Their language and speech are impaired. They have impaired social behavior, among many other characteristics which prevent them from interacting with others. The Rett syndrome is a neurodevelopmental disorder that affects a person's gray matter in the brain. The disorder appears to affect only females. Once a child is born, the disorder causes a number of deficits. It's associated with decreased head growth and poor motor skills on its onset. Additionally, the disorder can result in poor language and social engagement, as well as poor physical coordination. Dr. Rhett Andreas, who discovered the syndrome in 1983, noted that children with the syndrome normally develop well during the first 6 to 18 months of their lives. In addition to gastrointestinal disorders, people with this disorder may suffer from seizures and poor verbal skills. Other effects of the disorder include constipation and growth failures that may affect their lives. Another type is also known as pervasive development disorder, which affects children and affects their cognitive abilities. It hinders their ability to communicate effectively and interact with others. The symptoms of the disorder are visible at birth, but it cannot be diagnosed until the child reaches the age of 4. A psychiatrist named Bleuler Eugene is believed to have coined the term persevering developmental disorder in 1991. The concept has since been developed by psychiatrists and pediatricians who carried out research and investigations such as Kanner. Children with the disorder may be very eager to interact with friends or classmates, but they may act socially differently from mainstream peers, leading to non-true connections. Furthermore, they have difficulty understanding figurative language, sarcasm, or speech. Additionally, they do not speak at the recommended age, and their speeches are repetitive. Before we continue, we'd like to ask a few moments of your time. If you want to support Autism Answers and its mission to spread awareness about autism, please leave a like and click on the subscribe button. This would help us create more engaging content for you. Now moving back to where we left off. Symptoms of autism are detected by their behaviors. One aspect that can be used to identify these individuals is their inability to follow social cues. These infants show little or no attention to social stimuli in their environments. There are also ways to detect disorders among children through speech complications. The child may have unusual gestures, delayed bubbling, diminished responses, or unsynchronized vocal patterns that do not resonate with their caregivers as early as a year after birth. As a result of nerve lapses, these children frequently repeat the same words, affecting their ability to speak. Because of their disorder, these children cannot maintain eye contact, for example, and they cannot use simple movements as a way of expressing themselves, such as pointing at something that they want. As a result of this disorder, a child cannot effectively coordinate due to a mental lapse. In some cases, depending on the severity of their symptoms, they may not be able to take care of themselves on their own. Because of the lapses in their mental ability, they cannot sustain themselves. They therefore depend on caregivers for basic needs and assistance with their daily lives. It is because of the stigma and a lack of enough sensitization that people living with these disorders become alienated. As a result of their perceived abnormality, they lack friends. Therefore, this widens the gap between them and mainstream society, causing them to be regarded as of no value to society, which is a false narrative. The majority of parents of children living with this disorder do not take them to school because of the social stigma attached to mental health problems. They hide their children, preventing them from receiving health care. As a result, the children cannot receive education because of their condition. Children, as well as parents and other family members, are affected by the disorder, so coping with it is difficult in most cases. In order to ensure the well-being of children with these disorders, parents play an important role. As a result, many parents of children with these problems are stressed. The incident is unexpected, so they are agonized by it. Therefore, they blame each other and may lead to a conflict, which may break up the relationship. Parents hide their children under the carpet for fear of being stereotyped by society as a result of this stressful situation. Parents and caregivers may feel overwhelmed when they discover or learn that their children has autism spectrum disorder. However, certain treatments and education programs and approaches can be used in order to reduce the challenges associated with autism. However, there is no cure for the disorder despite efforts and research. It has been shown that interventions that reduce or lessen disruptive behaviors and provide learned coping mechanisms that allow for independence may play a significant role in containing the prevalence of the disorder. Despite the fact that no single treatment is effective in treating people on the spectrum, there are therapies and training that can help in dealing with the difficulties that can be a consequence of the disorder. It is essential to begin treatment early and tailored to the individual's specific needs, strengths, and weaknesses. A variety of approaches can be used, including behavioral, educational, sensory, and other interventions. Further, biomedical treatments include minerals and vitamins, immune system strengthening, diet modifications, immune system regulation, gut treatments, among others. Autism spectrum disorder is not widely known and what it means. Ignorance has contributed to an increase in the number of late diagnosed disorders. As a result, it's crucial that campaigns and sensitization campaigns inform the public about the disorders and where they can receive treatment and education. Through seminars and workshops around the globe, the Center for Disorder Control and Prevention has played an important role in educating and sensitizing the public about the disorders. A month-long autism awareness campaign is usually held in April. During the month, various media are used to inform the public about this disorder. Parents are mainly targeted because they spend a lot of time with their children. Like any other disorder, autism should receive the attention it deserves. Children with autism can be diagnosed at an early age. Proper treatment and diagnosis are crucial. To provide early medication, parents and caregivers must know about the required diagnosis and treatment. In addition to increasing the awareness of parents of the disorder, health groups should ensure that enough campaigns are conducted to inform parents about the disorder. This will help reduce the incidence of discrimination related to the disorder, as well as provide parents with the support they need. And that's what we have for you today. What are your thoughts? Let us know in the comment section down below. If you want more content related to this topic, make sure to check out our channel. Take care, and we'll see you in the next video.